Minister Dix, a very good morning to you, and thank you for doing this.
Hey, good morning, Vijay. Walk-in Wednesday, it can't be better than that. Everyone can walk in anywhere in BC to any immunization center without an appointment and get their dose 1 vaccine, and if their time is right, to get their dose 2 vaccine as well. So it's a really exciting day.
So 20,000 doses are kept on reserve at all the locations, and people can just walk in to get their shot.
That's right. It's 20,000 more than usual, so we're ready to take everybody today. And it's really important that people do it. As you know, most cases of COVID-19, the overwhelming majority now that we get, including of the variants, the Alpha, the Gamma, the Delta variants, all three of which are present in BC, are amongst those who are unvaccinated. So this is the time to get vaccinated so we can all be safe and continue to deal with COVID-19 in the coming months. In particular, in the central Okanagan region, we're seeing lots of cases right now, and we're really encouraging people there, but everywhere in BC.
Now, Minister Dix, the spread of the variants, specifically the Delta variant, has this raised the level of vaccination that needs to be achieved to get to the herd immunity level?
Well, I think we have a very high level of vaccination by any international standard. BC is at 81.4% of people over 12, which is basically amongst the best in the world. But that's not uniform across age demographics, and it's not uniform across regions. So in Fraser Health, we have a very high level of vaccination really across the board, but we need to get higher, right? In Interior Health, it's the same as Fraser Health in demographics over 50, but not as good, by about 15 to 20% amongst those who are under 50. So we've got to raise those levels there. I think it's important because we tend to socialize with people in our own demographic, right?
Right.
20-year-olds socialize with 20-year-olds, and people my age, the same, right? And so if you have a demographic in a region where there's a low immunization and the Delta variant is present, you're likely to see quite a bit of transmission, and it can have this is a nasty, vicious virus. So we're encouraging everyone to get immunized. 81.4% is great right now, but we can do better, and we need to do better.
Now, the Walk-in Wednesday and all these other various strategies are all a part of the push to encourage people to get vaccinated. Now, what other strategies are you considering? Is there also a more of a terse stance in the works if we can still not achieve the level of vaccinations that we want? Like something that's been done in New York City. They are saying starting August 16th, people will need to present proof of full vaccination if they need to go to a restaurant or to go to a gym. Is that something being considered in BC? Or also, are you open to giving people incentives like cash awards or something else to go get vaccinated?
Well, getting vaccinated is a gift, and it's a great gift for everybody. And here's what I'd say to everybody, that yes, people have the right not to be vaccinated, right? You can choose not to be vaccinated, but that has consequences. For example, anyone who isn't vaccinated, they're not going to be able to travel outside of Canada, I don't think, anytime in the coming decade. Okay? So if you want to go to Blaine or Bellingham or Belgium or Bangladesh or Botswana, doesn't matter where you want to go, you better get vaccinated. That's point one. Point two, in healthcare, we're taking measures to ensure that everyone's vaccinated. And if you don't, there will be consequences to that, including regular testing. You have to wear PPE that other people don't have to wear in others, but we're taking steps there. And I think other businesses are going to take steps within their own business to make sure their staff are protected and so on. So I think the message is that getting vaccinated is good for you, for your health, for your family, for your community. And if that's not enough, then there are consequences to not being vaccinated, and there's things you won't be able to do. And that's just the reality of a COVID pandemic, which is serious, and a COVID virus that continues to affect people's health everywhere in the world.
You changed your strategy to put regional restrictions in the Kelowna area after the outbreaks there. Now, is that something that can be done sector or region by region if that's the need, just to make sure that these upticks in number of cases can be suppressed?
That's right. It's a change in strategy that's the result of vaccination. So because we have 81.4% of people vaccinated, we're going to be having a much more targeted strategy around restrictions. In the week before the restrictions were put in place by Dr. Pollack, who's the medical health officer in the Interior Health Authority, the Central Okanagan Local Health Area had half of the cases in all of BC. Now, there are 89 health areas in BC, and that one had half the cases. The other 88 had the other half. And so we took the precise measures there. Equally, if there's transmission, say, in a business, it's very likely the business will be shut down for a period of time while they deal with COVID-19, and that will have consequences. So we won't be, say, shutting down every restaurant or every fitness thing or limiting all of them, but we will be taking precise measures. In addition to that, there'll be all of the contact tracing and all of the isolation that will continue in BC. So that's a change in strategy that's related to vaccination. And today, you see this opportunity, you see across especially across Surrey, for example. We have multiple locations in the next number of days, and you think about it. Today at the Cloverdale Recreation Center, at the Guildford Recreation Center, at the South Surrey Recreation Center, at our Surrey North thing at 10025 King George Highway. We have all of those, but we're also doing different things. So we're on tomorrow. We'll be at Kitts Beach in Vancouver. Later in the week at the Cineplex in Coquitlam. Later in the week, over the weekend, at the Fiji Islamic Center in Surrey. So we're changing our strategy to a degree to try and reach people where they are as well, whether it's on the beach, Centennial Beach in Delta today. So we're changing our strategy to try and reach people where they are as well, to make it easier so that nobody can say, oh, we couldn't find a clinic or it wasn't convenient to us. We've got to take the vaccine to people, and I think that strategy will continue to work as well.
And Minister, could that strategy, that shift in strategy, also be applicable to people coming from Alberta after August 16th? Because Alberta is abandoning all protocols and all restrictions when it comes to COVID, even letting the COVID positive people not having to mandatorily quarantine. So is that something that's in the works or could be considered?
Well, I don't think in Canada, and generally interprovincial travel is a federal thing, but I don't think in Canada we're going to have borders between provinces. But what it says to everybody is it is absolutely critically important to be vaccinated. So we welcome people who are vaccinated from anywhere, and we're going to soon be welcoming people who are vaccinated from the United States into Canada because of the decision of the federal government. But it tells us that we need to get vaccinated. But the problem in Kelowna is not an Alberta problem; it's a Kelowna problem. But
the Alberta situation could magnify it, couldn't it? Because a lot of people travel between Kelowna and Alberta.
Well, we need to absolutely, and I mean absolutely, raise our immunization levels. Because this is a world pandemic. So there's Alberta, you're right, that's a concern, and there's significant cases in the province of Alberta and a lower vaccination rate than BC. But it's not just Alberta, it's the rest of the world. We're living in a worldwide pandemic, and the best way we can respond to it, everybody listening to me right now, best way they can respond to it is get their dose 1 vaccination, and if it's their time, get their dose 2 vaccination. If we do that, we are going to be well protected for what comes.
There were some provinces in Canada, I believe it was Ontario and Manitoba, who said that people coming from other parts of the country, from within Canada, when they enter the province, they will have to quarantine for 14 days. Is that something that would be done if Alberta goes ahead, pushes through with the changes that they want to implement starting August 16th? That if an Albertan comes to BC and if they're unvaccinated, then they need to quarantine for 14 days?
That's not something that we're planning at this time. The most prominent place where such measures were taken were the Atlantic provinces, I think, where there was what was called the Atlantic bubble.
The bubble, yes.
Where they had that at different times. We're in a different circumstance now. 81.4% of people have been vaccinated in BC. We need to raise that up. That's what we need to do right now. We need to focus in on that. And right now is the time to do it. Today, Walk-in Wednesday. Anyone listening to me should be able to go and get vaccinated today, wherever they are within Connect FM's range and their listening audience. Everyone can. That's how we're going to protect ourselves, by continuing to raise that level of vaccination. And in BC, we're going to continue to contact trace. We're going to continue to have isolation for people. We're still at step 3 in our reopening plan, and we've got to continue to follow public health orders in BC. That's how we deal with the situation, because there's a tendency to always want to blame others, but we have to do what we can do in BC to protect ourselves as well.
Minister Dix, another thing that I want to bring to your attention, some of our listeners have reached out to us and they say it's becoming increasingly difficult, while everything else is opening up, to still get an in-person appointment with their family doctors. Is that something that is a decision solely based on the family doctor and their office, or is there something that the ministry can do so that people have an easier access for those who need an in-person appointment with their family doctors?
Well, I think, first of all of the urgent primary care centers we've opened over the last 3 years have made a huge difference in the pandemic, right? Because there has been a lot less, as you know, there's been a lot of virtual care in this period. And while virtual care has proven to be itself to be really valuable, it's also really, sometimes you need to go and see somebody, right? And that's why the UPCCs have been valuable and why we've opened the ones we've opened in Surrey, for example, but also in Burnaby and in communities around BC. I think we're going to see doctors transitioning back to more regular office hours and transitioning away from virtual care again. I think we're going to see that over time, just like other businesses and groups are doing that and have been doing that now. So I think you're going to see more of that. And we're working with family doctors to ensure that people get the care they need, because it is a transition now, and for many people who need a family doctor, the virtual care has been both a godsend during the pandemic and also something that sometimes you need to see people in person. So we're working with family doctors on those questions, and they, like every other business, like restaurants and others, are working with how they're going to deal with this phase of the pandemic. And we're working together to see if we can help out there and help each other there to get that done. Because you're right, there are some people who'd like to see a doctor in person. The UPCCs are there, but they're not, obviously, not everyone's going to be able to go to a UPCC. So we want to also work with family doctors to see us move towards a reopening there. And we're doing that carefully and in consultation with family doctors.
Mr. Dix, thank you so much for your time this morning. Thank you very much.
Hey, right now, anytime, Vijay. And remember, Walk-In Wednesday, everyone needs to get vaccinated today if they can.
For sure. Thank you so much.
Take care.
Bye-bye.